So traditionally in healthcare, we've seen a division between medical care and psychological care. And so for issues having to do with our physical bodies, we go to a medical provider. For issues having to do with our mental health, we go to a mental health provider. And more often than not, those providers are housed in separate clinics across town, and they're not really communicating with one another. And so what we know the reality is that our mind and our body are fundamentally linked. And so our mind impacts our body, and our body impacts our mind. And so if we look at the example of chronic pain, this illustrates this concept really clearly for us. So for individuals who are in physical pain, who have chronic pain conditions, they will show emotional consequences of that pain. So we might start to see depression, anxiety, we might start to see anger or irritability that wasn't there before. And in the reverse, we know that our emotional state can impact our physical well-being. And so on those days when that chronic pain patient is experiencing a lot of stress, maybe they're feeling anxious or depressed, they will actually report experiencing higher level of pain intensity. And so it really does have that impact on the way that they experience their pain. So knowing all of that and keeping all of that in mind, what we've been seeing is more and more the implementation of multidisciplinary treatment teams. And essentially that means that we have mental health providers and medical providers working together collaboratively to address patients' overall health care holistically. And so we're not missing out on pieces of that individual's functioning by just focusing on one piece of the puzzle.